Let's talk about psychiatric nurse practitioners. This is a career option I think is particularly beneficial for students who are interested in psychiatry, but maybe not interested in medical school, or you want to cut down on the number of years of schooling that you need to be able to practice. A psychiatric nurse practitioner, or PNP, is a specialized nurse who focuses on mental health. They help people who are dealing with conditions like depression, anxiety, bipolar disorder, and schizophrenia. PNPs figure out what's going on, create personalized treatment plans, and offer solutions like medication, therapy, and lifestyle changes. PNPs can prescribe medications and keep track of how well they're working, making changes if needed. They also provide therapy, guide patients and their families through their mental health journey, and explain the different treatment options available. PNPs also work closely with other healthcare professionals. They stand up for their patients' needs, and they may also contribute to mental health research or shape healthcare policies. Psychiatric nurse practitioners work in a variety of healthcare settings due to their specialized training in mental health care. So most of them are like the most common place that they work includes hospitals where they may be involved in acute care or emergency mental health services. They also commonly work in outpatient mental health clinics where they provide ongoing therapy and medication management for patients with chronic mental health conditions. PNPs are also frequently employed in community health centers, rehabilitation centers, and private practices where they can focus on longer-term care and mental health management. And then finally, in addition to these settings, they can be found working in residential treatment centers, schools, and correctional facilities. And this is just some of the many ways that they can address mental health needs of diverse populations in these different environments. To become a psychiatric nurse practitioner, you'll need to follow 5 key steps. So first, you're going to start with a bachelor's in nursing. This typically takes about 4 years and includes both classroom and clinical experience. After earning your BSN, you'll take a National Council licensure examination for registered nurses. This exam will help you become a licensed registered nurse, and passing this exam allows you to start working as a nurse and gaining valuable experience. Before advancing your education, it's beneficial to work as an RN, ideally in a mental health setting, to gain practical experience. Most graduate programs are going to require that you have at least 1 to 2 years of clinical experience as an RN before they will admit you. Next, you'll apply to be accepted to a psychiatric mental health nurse practitioner program, which can be at the master's level or the doctoral level. These programs are going to take between 2 to 4 years to complete, depending on whether you're going full-time or part-time. And the curriculum includes advanced coursework in psychiatric assessment, diagnosis, psychopharmacology, and therapeutic techniques, along with clinical rotations in mental health settings. And then after completing your graduate program, you'll need to pass the PMHNP certification exam administered by the American Nursing Credentialing Center. So once certified, you can apply for state licensure to practice as a psychiatric nurse practitioner in your state. So, acceptance rates for master's programs typically range between 20 to 40%. Top nursing schools like Johns Hopkins or the University of Pennsylvania often have acceptance rates on the lower end of this range because they're popular and they have really rigorous selection criteria. So programs at less well-known institutions or those with larger cohorts may have higher acceptance rates, sometimes exceeding 50%. Doctor of Nursing Practice or PhD in nursing with a specialization in psychiatric mental health programs are generally more competitive with acceptance rates between 10 to 30%. The lower rates are due to advanced level of study, the limited number of spots, and the expectation that applicants have clinical and research experience. According to the Bureau of Labor Statistics, employment for nurse practitioners, including those specializing in psychiatric mental health, is projected to grow by 46% between 2021 and 2031, much faster than the average for other occupations. This demand is driven by an increasing awareness of mental health issues, an aging population, and a shortage of mental health professionals. As of 2024, the average annual salary for PNPs is approximately $124,680. This figure can increase in states with higher demand for mental health services or in specialized settings like hospitals and private practices. Additionally, salary surveys from nurse.org indicate that experienced PNPs can earn well above this average. Looking at the map on the screen, you can see that Tennessee is the state with the lowest salary at approximately $99,000 a year, and California is the state with the highest at around $158,000. To stand out when applying to graduate school for psychiatric nursing, undergraduate students can take several strategic steps. So the first of which is to maintain a strong GPA, particularly in science and nursing related courses. So this is crucial. Competitive programs often favor applicants with a GPA of 3.5 or higher. Second is to gain clinical experience, so volunteering or working in mental health settings such as psychiatric units, community mental health centers, or substance abuse treatment facilities. All of these can provide valuable hands-on experience. This experience not only strengthens your application, but also demonstrates a genuine interest in the psychiatric field. Third is to pursue relevant certifications, so obtaining certifications like basic life support or even mental health first aid. All of these types of things show your commitment to the field and your readiness for advanced study. Fourth is to build strong relationships with faculty. Developing relationships with professors and clinical instructors can lead to strong letters of recommendation, and these are vital for graduate school applications. And then lastly, fifth is to get involved in relevant extracurricular activities such as joining nursing or psychology-related student organizations, attending conferences, participating in workshops related to mental health. Participating in undergraduate research, especially in topics related to mental health, can also help set you apart. Students not familiar with this career option often wonder how it differs from psychiatry. One of the notable differences is the education and training required. Both require a bachelor's degree. If you want to be a psychiatric nurse, you'll need to get a BSN. If you want to be a psychiatrist, you can get a bachelor's in almost anything. You just need to make sure you complete the medical school prerequisite courses. After earning a bachelor's degree to be a psychiatric nurse practitioner, you'll need 1 to 2 years of clinical experience. To be a psychiatrist, there's no requirement to get additional work experience before medical school. In terms of graduate education, psychiatric nurse practitioners can complete a master's or doctoral level degree in nursing, taking between 2 to 4 years. To be a psychiatrist, you must complete a doctoral level degree in medicine, which takes 4 years, either an MD or a DO. To be a psychiatrist, you must then complete a 4-year residency in psychiatry. Although a residency is not required for a psychiatric nurse practitioner, they are available and they generally last about a year. Both fields require licensure and certification prior to practicing. And then altogether, a psychiatric nurse practitioner will require 7 to 10 years of both education and clinical experience, and a psychiatrist is going to require 12 to 14 years. Salary.com puts the median salary for psychiatric nurse practitioners in the U.S. at about $120,000 and the median salary for psychiatrists at about $255,000. So psychiatrists and psychiatric nurse practitioners have different educational backgrounds and scopes of practice. Psychiatrists are medical doctors with specialized training in psychiatry. They can handle more complex cases and perform medical procedures like electroconvulsive therapy, ECT. Psychiatric nurse practitioners share many responsibilities with psychiatrists, such as conducting assessments, developing treatment plans, prescribing medications. However, some states do limit their scope of practice. For example, in some areas, psychiatric nurse practitioners may need a physician's approval to prescribe certain medications. Despite these differences, both professions are essential in providing comprehensive care to individuals who need mental health services and mental health support. Thanks for staying with me. Hopefully this gives you a better idea of what a psychiatric nurse practitioner is, as well as how it compares to being a psychiatrist. Please leave any questions that you might have in the comments.